Good afternoon and happy Monday. My name is Chelsea Wallace, and I am a graduate student with the University of Alaska Anchorage. I am in the Masters of Business Administration program, focusing on a healthcare administration emphasis. My goals today are to discuss 3 key strategies to improving the health of the people in the Arctic. Here is our agenda items for this presentation. There will be an overview on circumpolar regions and health. Where are we today as far as hitting goals and metrics, with a focus on Indigenous people in Alaska. We will define 3 strategic ways to improve health in the Arctic. We will identify which leaders in our communities can help with these strategies, and then a closing statement. So I wanted to show an image of the circumpolar regions of the globe. I know many of us have an idea where the North and South poles are. However, I thought these pictures did a great job at showing how many countries are within the circumpolar North and South. So what is circumpolar health? Circumpolar health is a focus on physical and emotional well-being of someone who lives in the geographic locations near the North or South poles. Just as we saw on the last slide, many countries and regions are encompassed in the circumpolar areas. In these regions, Indigenous peoples inhabit much of the land. Indigenous people are culturally distinct societies and communities that are the earliest known inhabitants of a location. Our discussion today will revolve mostly around the Indigenous cultures of Alaska, but we will have some discussion on data from other areas such as Canada, Greenland, and Denmark. It is very valuable to know that Indigenous people have distinct traditions, history, and culture that influence every aspect of their life. And when the first settlers came to these areas, many of which who were European, Euro-American, or Russian, had many different illnesses that the Indigenous people had never encountered. This led to new and complex health issues. These diseases brought many challenges as access to care in the Arctic can prove to be very difficult due to remoteness, weather, and limited providers. Healthcare had to evolve to promote positive health outcomes. So where are we today? In the past, there had not been a lot of data and literature collected around Indigenous people and the health issues and disparities that affected them. However, that has changed. There has been positive awareness, discussion, and research around best practices to help improve outcomes for all of our community members. Some metrics I wanted to use for today's presentation was the Healthy Alaskans Goals. Alaska sets goals for its community members and Alaskan natives to promote wellness and prevent negative health outcomes. Their current scorecard for 2020 outlines key metrics and improvement areas. The next 2 slides we will go through quickly. These are the Healthy Alaskan 2020 scorecards for how Alaskans and Alaskan natives are meeting leading health indicator goals. As you can see towards the bottom of the page, the green star means you've met your target, the blue diamond means you're on track, the orange triangle is little or no progress, and the red octagon is getting worse. The focus of my 3 key strategies for improving health in the Arctic was emphasized by the goals that are getting worse or marked by the red octagon. Let's start with improvement strategy number 1, which is ways to improve diet and exercise. This slide highlights facts about the negative outcomes of a poor diet and lack of activity. 65% of Alaskan natives reported they were overweight to obese. Data from the Inuit of Alaska, Canada, and Greenland reported that 37% of men were overweight, 16% of men were obese, and 33% of women were overweight, while 16% of women were obese. 13 cancers are associated with obesity. Those include meningioma, which is brain cancer, adenocarcinoma, which is esophagus cancer, multiple myeloma, which is blood cell cancer, and then cancer of the kidneys, uterus, ovaries, thyroid, breast cancer, liver, gallbladder, stomach, pancreas, colon, and rectum. Lastly, 40 to 70% of Alaskan natives reported that they could not afford enough food. This led to the purchase of cheaper alternatives that were high in saturated fats and sugars. With these presented facts, we can see that diet and exercise is a major problem for the people in the circumpolar north. My strategies include supporting local farmers markets, supporting policies that provide local food such as fresh fruits and vegetables to education centers, advocating for state-run programs that encourage local food distribution, allowing time off for work to support cultural food gathering activities. I believe we should be promoting positive reinforcement for children when they play or are physically active. And we also need to limit sedentary behaviors such as sitting at home on the computers or our phones. We have to promote community or family outdoors activities. That could be a walk in the morning or after school. And we have to make sure that community members are aware of negative health impacts that are attributed to sugary foods, such as type 2 diabetes and other cardiovascular problems. One other item I didn't note on the slide is I think we have to support physical activity at our education system level. We have to support policies that require physical education in schools. Many institutions are taking away that outdoor time or asking families to pay. My second improvement strategy revolves around support for mental health initiatives. Here are some very telling facts about mental health within Indigenous cultures. The top 4 reasons that Indigenous people of the Canadian Arctic requested psychiatric help were listed as depression, suicidal thoughts or attempts, family or relationship problems, or grief. American Indians and Alaskan Natives have 3.5 times higher risk of suicide. And in 2017, suicide was the leading cause of death for American Indian and Alaskan Natives between the ages of 10 to 34. Adverse childhood experiences, or ACEs, are linked to chronic health problems, mental illness, and substance abuse. And 1 in 7 children have experienced childhood abuse or neglect in the past year. Now, I want to expand a little bit on ACEs. ACEs are traumatic events that have a negative and long-lasting effect on the health and well-being of a person. This can include abuse, neglect, household dysfunction, damaging behaviors at home. And all of these can have severe effects on the physical and mental well-being of a child or an adult. My improvement strategies for mental health support are listed as the following. We need to support community awareness that mental health issues are a medical condition, and we have to remind our community members that mental health problems are treatable with the help of a physician, a counselor, or even a medication regimen. We have to understand that communication styles of Indigenous cultures may be different than what we're used to. Indigenous people may have nonverbal communication. We need to promote awareness around call centers, especially for people in the midst of a mental health crisis. We have to support policy that increases long-term care housing for behavioral and mental health. We have to understand the roles of healthcare workers at a village or town level. Here in Alaska, we have community health aides and behavioral health aides that have basic training in healthcare. And they also live within these towns and villages, and they are able to identify problems immediately. ACEs have to be reduced to prevent childhood and adult trauma. One example may be connecting children to a youth or young adult camp that promotes their Indigenous culture and connectivity. My last strategy for improving health in the Arctic revolves around access to care. As we discussed, many of these rural locations are outside of the major metropolitan cities and are far away from big hospital systems that have plenty of healthcare providers. 6 in 10 American Indians and Alaska Natives work, but have significantly higher rates of poverty when compared to the overall population. In the early 2000s, 98.5% of Denmark's healthcare budget was spent on curative services, while 1.5% was spent on preventative and research. Indigenous people in Greenland at times have to endure 6 to 7 hours of travel to receive advanced care in Denmark. Healthcare staffing is cited as the largest factor affecting access to care. So what are some more specific strategies that can improve access to care for the people in the Arctic? Supporting telehealth and telemedicine can connect Indigenous people with their healthcare providers. This can also reduce wait times as there can be same-day appointments. We have to support policies that look to build new medical buildings and centers at smaller towns or villages. We have to encourage health insurance if people are uninsured. We have to look to programs that encourage at-home healthcare management. One example may be getting blood pressure monitors to people's homes so they can monitor their own blood pressure levels. We have to provide more research to circumpolar regions. This will help identify negative outcomes and look to ways to improve health. We have to identify ways to retain doctors and nurses that are serving these areas. This may be by continuing education reimbursement or loan payback programs to these type of healthcare workers. We have to strategize on education programs that can encourage community members to begin schooling in healthcare as well. There are some key leaders needed to promote these changes. Number one is that we need our healthcare professionals. They provide the necessary health education to these regions, they identify necessary interventions, and they coordinate culturally sensitive care plans. We need policymakers and our government to help obtain funding, either if that's governmental or private funding, so we can have actual dollars to improve initiatives that support laws and the Indigenous people and their culture. We need our education system. They advocate for healthy school lunch programs, they provide education materials that are factual, and they do help us bridge that gap for children and young adults. We need our public health departments. They are so crucial and instrumental at providing community-based care that focus on disease prevention, and they understand the importance of cultural ethics. And last but not least, we need to call on our tribal health leaders locally. For Alaska, there are tribal affiliation organizations all over our state that promote wellness for Indigenous people. I listed out just a few here, but there are many more even outside of the US. And you can see how important this is to the right of our slide with all of the different demographics in the Indigenous nations that are represented in just one state. So how can all of us help? We may not work in the government and we may not be a doctor, but we do have a voice. We have to become more aware of cultural norms other than our own. We have to be sensitive to other traditions and cultures. We have to search for public resources that support areas outlined in these improvements. We may not have all the details, but we should be able to point people in the right direction. Each of us has to support changes that move government funding or private funding into public health and into circumpolar research. We can also volunteer and partner with local food banks or community outreach programs. We can educate each other on the need for health insurance coverage. And last but not least, we have to continue to promote emotional, spiritual, and physical well-being of each person. My last two slides are just references. I wanted to say thank you again for watching this presentation, and if you have any questions, please feel free to email me at cjwallace4@alaska.edu. Thank you.